LASIK is a procedure which is used to treat usually myopia or short sight, but can also be used to treat hyperopia or long sight. And in this technique, you remove the epithelium, the skin on the surface of the cornea, and then apply laser treatment to the surface of the cornea to alter its shape. Once the laser treatment has been applied, then usually a contact lens is placed on the surface of the cornea to encourage healing and also to improve patient comfort. In the technique, it's technically relatively straightforward because laser is applied directly to the surface of the cornea. And the disadvantage is that it can be associated with a little discomfort, maybe 24-48 hours after treatment. However, you avoid the complications of or potential complications of the alternative treatment of LASIK. It's generally used for lower corrections, so lower degrees of myopia, perhaps up to -3. Beyond that, you can increase the risk of haze forming, which can take some time to dissipate. Following a LASIK procedure, the contact lens is removed generally after 5 days when the corneal epithelium is healed over again, and the vision starts to recover between 5 and 10 days post-operatively.